Okay, part two. So, like I stated, the nurses, they all jumped into action. They were going off of my blood work. Blood work showed that type 2 diabetic, my blood sugar at that point was 806. So, the biggest thing, the nurse was like, I don't see how you're talking to me right now. I don't see how you just got up and went to the bathroom on your own. Normally, when a person comes in and their blood sugar is at 806, they're headed to the ICU. They're not pretty much not responsive in a way is that they aren't coherent enough to talk to you. And they're in a diabetic coma. So she was very shocked about that. And she's like, in looking at your lab work, your kidneys aren't affected. Normally, the kidneys are shot, the body is starting to shut down. This is different. So I stated to her, like I had my niece with me, so I'm going to back up just a second. When you got to go into the hospital, always make sure you have somebody that could be your voice just in case it ever comes to a point where you cannot speak for yourself. So I explained to the nurse, the young lady that drew my blood, she did not tell me who she was. She did not tell me what she was doing. I do understand this is a very important situation. It's, very scary situation. I am not a difficult patient. However, I do demand clarity. So I need to be told what's going on. Anything that you're going to do to me, I need to make sure that I know what's going on. Whoever touches me, they tell me who they are and what they are doing. At this point, she's like, okay, we're about to get you some fluids. Baby, you are almost depleted on everything. We're about to get you some fluids, and we're about to just see how we can get these numbers down. Because if we cannot get these numbers down, you are going to have to stay the night here at the hospital till we can figure it out. But right now we're trying to see if you're going to the second floor or the third floor, which the third floor is ICU. So we're trying to see where exactly you are going to pan out and go. So they did get my blood sugar down to, I want to say, about 600. They gave me a whole lot of fluids and things of that nature. Also, no. If you are not compatible with the staff that comes in and that's trying to treat you, you can always ask to have them leave out and have somebody else to come in. Always remember that. So by this time, they're like, sorry to let you know, even though you don't have to get an insulin drip or anything of that nature, you have to stay overnight. You're going to the second floor and we're going to have a doctor to see you, but the doctor has to okay for you to come to his floor. So they sent in like a little, what is it, like a little TV thing, and I had to talk to the doctor before that he would set me to the floor. Very scary. Once again, take care of yourself, and I'm going to keep going.